In this video, we reveal to you 5 ways to actually prevent hair loss. Number 1. Seek help as soon as you notice a change. If you want to fight hair loss, you need to visit your board-certified dermatologist at the first sign of thinning or shedding. Getting treatment for hair loss in its early stages can help minimize overall hair loss and increase the odds of a treatment's efficacy. Hair loss can seem overwhelming, which is why it is necessary to consult with a dermatologist who will assess your condition and explain all of your treatment options. Number 2. Build a proactive plan that works for you. There are 3 hair loss prevention options that you should consider, and they all work to stimulate regrowth on dormant follicles too, the ones that have weakened but haven't died out entirely. Talk to your dermatologist about the following 3 methods and how you can use them in tandem for an even better defense. Finasteride. Finasteride, commonly known as Propecia, blocks the formation of DHT, dihydrotestosterone. DHT is a male androgen hormone which contributes to hair loss by making hair follicles thin and short. Hair grows in 3 phases, and DHT disrupts the hair growth cycle, anagen phase. As a result of this disruption, the hair goes into a longer rest period, which makes the hair stop growing. So, by blocking the absorption of DHT, Finasteride helps promote hair growth. Minoxidil. Minoxidil, which you might recognize by its patented name Rogaine, is available over the counter. By dropping it onto your crown twice daily, it increases blood flow to the hair follicles, thus strengthening and thickening them. The hair grows fuller and is in turn less susceptible to permanent fall. Minoxidil also boosts the hair follicle during its regrowth stage after natural fall occurs. It's particularly effective on the crown of the head and will promote uniform thickness, but isn't an effective defense against hair recession at the temples. Platelet-Rich Plasma Prp. This one might be new to you, and it's certainly the most unique and deluxe option. PRP uses the platelets in your own blood to stimulate hair growth. The first step at getting PRP is having your blood drawn and then spun in a centrifuge. Spinning the blood separates the red blood cells from the platelet-rich plasma. Finally, the plasma is drawn into syringes and injected into the scalp by the doctor. Platelets contain growth factors that promote healing and stimulate the hair follicle to begin a new growth cycle. Yes, you heard that correctly. They draw your blood, separate the plasma, then inject it around your head. For the best results, you should do this once a month for 4 months at the start, and then quarterly or biannually afterwards at minimum. It can come with a high cost though, and unlike the now generic drugs Finasteride and Minoxidil, a single treatment can run you $1,500 or more, so be prepared. Number 3. Supplement your diet with more than Just Biotin. There are numerous vitamins you can take that help your hair grow faster and stronger. Biotin is always mentioned in this vein. In general, however, a nutrient-rich and health-conscious diet will cover many of those same bases. Instead, consider more targeted, specialized supplements. Viviscal promotes hair growth by providing nutrients your hair needs to grow, such as B-complex and zinc, among other nutrients, which promotes thicker, stronger, and longer hair. Nutrafol is an amazing vitamin formulated with marine collagen, saw palmetto, and ashwagandha. Marine collagen is enriched with B vitamins, which promote hair growth. Saw palmetto prevents testosterone from being converted to DHT, and ashwagandha reduces inflammation. Number 5. Cut the bad habits. Stress can't always be mitigated, but bad habits can be. Many of the things you do routinely might be contributing to your hair loss. Not shampooing enough, but also shampooing too often can also contribute to hair loss. Poor diet can also contribute to hair loss. You should consume a diet rich in oils, protein, and nutrients to nourish your body and scalp. Lastly, as mentioned in the previous tip, smoking and alcohol both aggravate hair loss. While they might seem to calm stress, they in fact restrict the blood vessels, thus reducing circulation and blood flow to the follicles.